Hi, good morning Alfar. My name is Eleanor Vince. I'm your invigilator for the OET speaking session on the 11th of March 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Alfar Newman.
And what is your candidate number, please?
My candidate number is 254832021.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What would you do if you were unsure of a task or assignment you had?
If I am unsure of a task or assignment, I would ask one of my colleagues for help or speak to my charge nurse about it. I would ask if they can assist me or teach me so that I can know and feel more comfortable in the future, and hopefully, one day, I can be that resource for someone. If there was no one I could ask at that time, I would definitely search for other resources as well, such as educational applications, or maybe another department that would know about this task. But I would definitely ask for help or guidance.
What are some of the most important things to consider in the nursing position?
Medications are not the only way to treat a patient. Yes, according to me, the most important thing is how not everything can be solved with a drug. We need to look more closely at what's happening with each patient and treat them individually. Each patient is different and requires a different level of care. The way we treat them plays a crucial role in their way to full recovery.
Why are interpersonal skills important in the nursing role?
If we highlight the role of a nurse, we can identify that a nurse communicates with the patients, fellow nurses, doctors, and other department staff. Hence, interpersonal skills are important in the nursing role. Nurses always work as a team. Also, speaking to patients in a way that makes them feel comfortable can be very beneficial. Communication can lead to a better understanding of what the patient requires in terms of treatment. For example, if the nurse isn't actively listening to the patient, they can miss critical information provided to doctors. The same happens in each hierarchy the nurse deals with.
Tell me about a time you had to deal with a difficult situation and didn't have the support of others available.
I was in a difficult situation in my previous job. I worked under a tight deadline, but couldn't get a few staff members to contribute to their work. Along with my duties, I have to manage the extra tasks assigned to me. I tried my level best and pushed myself harder. However, I knew that I wouldn't be able to complete the assignment on time. Ultimately, what I did was have the deadline extended by using my communication skills. Asking our client for 2 more days was easy when I gave them all the facts.
What are your career goals?
I'd like to become a nurse manager in my career. I believe that I can utilize my knowledge and managerial skills to enhance the nursing field. I can make sure that each patient is getting adequate care and attention. At the same time, the nurses can work comfortably, taking care of their health as well. Thus, the practice should be implemented to all the nursing departments in the facility. I believe that personal care can be standardized across the community. What I focus on is that I would like to bring a better care structure that could be a revolution in the sector.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patients or perhaps a relative and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Hi, good morning. My name is Alfar Newman, one of the nurses working in the community health center. May I know your name for the record, please?
Good morning. My name is Eleanor Vince.
Hello, Eleanor. Good to see you. Well, may I know the reason for your visit, please?
Sure, I had a cold for a couple of weeks.
Okay.
And as a result of it, the mucus has built up. Hence, I need to clear my throat a lot.
All right. Could you please tell me how you feel about it?
Nurse, I feel this as quite unpleasant, not just for me, but for the people around me as well.
I understand your concern, Eleanor.
Thank you, nurse. So, I want some advice on the treatment.
Sure, of course. Try not to be worried. Before proceeding to the treatment, I would like to know more about the details of your symptoms.
Yes, you may proceed. What would you like to know?
Do you have a runny nose?
Actually, I don't have a runny nose. But I was coughing a lot.
Okay, is it a dry cough or a productive cough with mucus?
Yes, I cough up a lot of white mucus, and as a result, my face and neck hurt.
I got it. And Eleanor, may I know whether this reduces the sense of smell or taste?
No. My senses of smell and taste are fine.
All right. Now, I will outline the ways to relieve your condition, which is called Catarrh.
Okay, nurse.
I would suggest that you drink cold water, before clearing the throat.
Oh, I see.
Also, try to do saline nasal rinse. When rinsed through your nasal passages, saline can wash away allergens, mucus, and other debris, and help to moisten the mucous membranes.
Oh, that's great.
Eleanor, it is better to avoid a warm, dry atmosphere. And I highly recommend you to stay well hydrated.
Sure, nurse. I will.
Now, I will suggest some over-the-counter medication. Specifically decongestants. Well, decongestants are a type of medicine that can provide short-term relief for a blocked or stuffy nose.
Okay.
Another one being antihistamines, which also relieves nasal congestion.
Well, nurse, I was hoping that you would give me a prescription for something, which would be more effective than over-the-counter medication.
Your thoughts are really sensible. However, I am sorry to say that I won't be able to provide you with a prescription. I would say a prescription is not necessary for your condition. And also, the prescription is not my role, and I couldn't do that. If the prescription was necessary for you, I would have suggested you have an appointment with the GP.
Okay, I understand that. I will try over-the-counter medication then. But nurse, I am worried that the problem might carry on for a long time.
Your thoughts are really understandable. Eleanor, I can reassure you that the catarrh is usually temporary and not harmful enough to be worried about. It is self-limiting as well.
All right. I understand what you are saying.
That's good to hear. And Eleanor, I advise you to see a GP if the problem persists for more than 6 weeks.
Oh, I see.
Because a visit to the GP will help to rule out if there is any underlying condition or unidentified food sensitivity.
I will follow your advice, and I will make an appointment with your GP if there is no improvement.
That's perfect. I hope I have cleared all your concerns. I wish you a speedy recovery.
Thank you, nurse. That is the end of your OHT speaking roleplay. All the best.
Thank you.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.